educate the next generation of healthcare professionals, refine research initiatives, and enhance our disaster management practices. Since its inception in 1996, when the SPH School of Public Health faculty designed and taught the first graduate level course of GIS offered in an American School of Public Health, the program has always been supported by a GIS lab. The lab we are inaugurating today is actually the fourth location in the last 13 years. From 1996 to 2002, this was the GIS lab. In fact, this building is now being used as a storage space in Eco Hall 1212. There was only one computer in that Dr. Daja talked about, and one printer connected to that. 2002 to 2003, the lab was relocated to a much larger room where we had 3 computers, one of which was stolen a few months after we moved in. Then in 2003, the lab was again moved to the former Jorgensen Learning Center at the east side of the Delaware Library until 2009 September, when we moved into this building. The Geoinformatics lab we are inaugurating today is a spacious facility equipped with 2 20-seat computer labs separated by a support room. The computer workstations are supported by peripherals such as plotter, GPS devices, printer, scanner, and others. The lab is integrated with the LLU campus backbone servers and benefit from 24/6 technical support personnel. The lab manages the ESRI software, site license, and maintains remote sensing and database management systems. The lab also stores and manages a significant amount of spatial data, including demographic, population, satellite images, and area photographs. The new computers in the lab are a radical improvement over what we've been using for the past few years. One change that is particularly exciting is the availability of a gigabyte networking between the desktops and our data servers. The lab supports academics, research, and service activities. First, let me speak briefly about some of the research projects that LLU faculty have applied geoinformatics methods to solving health issues. LLU is funded by the U.S. Centers of Disease and Control Prevention as a Center for Public Health Preparedness, and as such, it is building preparedness and response capacity in the region's Native American tribes and California's 2,500 registered environmental health specialists and emergency preparedness workforce. In this project, geospatial methods were used to investigate and characterize the pattern of spatial deployment of the California's environmental health workforce rooted in local health departments, as well as to identify conceptual and organizational factors associated with workforce deployment. In addition, we are actively involved in training all those in risk assessment activities, including emergency managers, state and local planners, GI specialists from insurance and utility companies with hazardous software, which is a GIS-based program developed by FEMA that aids the management of natural and man-made disasters. In collaboration with the San Bernardino County Health Department, we developed the vector control surveillance system, which enables local local public health officials to accurately monitor the growth and movement of vectors, including fleas and ticks, in order to track the potential spread of health threats such as the West Nile virus, Lyme disease, encephalitis, and hantavirus. Under this system, vector control inspectors can use laptop computers in the field to enter data into digitized forms and geographic information system. The information is then automatically incorporated into a centralized database that combines the data with local area data sets, including local demographic information and historical data on disease outbreaks. Through the National Children's Study, we are preparing to geocode live birth for San Bernardino County residents, the block level for the most recent 5 years, to perform physical verification of a sample of geocoding results for accuracy. This project is funded by the National Institute of Health. In the nation, the National Children's Study examines the effect of environmental influence on the health and development of 100,000 children across the United States, following them from before birth until they are 21 years of age. The goal of this study is to improve the health and well-being of children. Partnering with Cal State San Bernardino, the Office of the Mayor of San Bernardino, the Latino Health Collaborative, the Center for Community Action and Environmental Justice, we are currently engaged in conducting a preliminary health risk assessment using hospitalization data and relating them to 18 busiest areas to estimate the potential health effects associated with residential proximity to busy railroads. The lab is also involved in several service activities. Through the Partnership for Quality Medical Donations, we are looking to link donors worldwide with resource-poor communities. The goal is to ensure that more efficient and effective distribution of medical donations, such as pharmaceuticals, applies and equipment to places where they are supposed to be. Loma Linda is using GIs to assist PQMD members to identify local resources, assess the condition of the resources, allocate them, and improve logistics and networking in areas receiving medical product donations. We have begun working in-house in trying to put our water system into a utilities map so that we can efficiently manage the water utility system on campus. In the end,